Assalamu alaikum. My name is Dr. Muhammad Ahmed Abdullah. I work as an assistant professor in Islamabad Medical and Dental College. I'm a family physician and a public health specialist. Today, we're going to talk about Limbs for Life, which is a special initiative of Firoz Sons. This initiative talks about saving limbs in context to diabetic foot. As we all know that one of the major complications of diabetes mellitus is peripheral arterial disease and as a consequence, people losing their limbs. So, according to the latest data, uh, one limb is lost around the world after every 19 seconds, and this is a major public health problem, and we need to solve this. One major way of solving is this. This is by educating ourselves and acting appropriately with all the patients we see. This is the module 16 of the Limbs for Life program. And in this, we're going to talk about intervention and circulation of foot and x-rays and their interpretation. So the objective of this program is to save the limbs because limbs are very important, and they affect our functionality, our mobility, and a loss of limb can have physical and mental effects on anyone. So we start off with the arterial supply of the foot, which is very important. Changes in the arterial supply might be very minute in the start, but as it progresses, it can have a sudden onset, which can be seen in the form of severe pain and change of skin color. As you can see in this diagram, the whole arterial supply of the foot and the most common arteries that you will be expected to palpate and see a pulse in will be the dorsalis pedis artery and the posterior tibial artery. But having said that, it is very important to be aware of the correct anatomical placement of all the blood vessels, the arteries, and the veins of the uh, foot when considering treating diabetic foot. So the early signs of necrosis are very important. A lot of times the toe is involved. There are subtle early changes, and they may mimic bruising or chill veins. A careful search should be made for early signs, which will include a toe which is developing a blue or purple tinge, a discoloration, and having been previously pink, and now it could be happening because of ischemia or infection. Uh, Concurrently, toes can become pale as compared to the other toes, and an ulcer could develop, uh, and the color of the ulcer would not be pink, and the color would be quickly changing in this scenario. So, we're going to discuss a case study of a 77-year-old man with type 2 diabetes who has had the disease for 12 years, and the duration of development of ulceration is prolonged, and his right fifth metatarsal head is involved. His feet were neuroischemic. This means that there was nerve loss as well, neurological loss as well, and then there was a limitation of the blood supply. So you uh, happen to see both the signs of neuropathy and ischemia in this foot. And then there was a severe deterioration with a mild fever and spreading of wet necrosis. This spreading of wet necrosis often coincides with the occurrence of an infection. A culture was taken, and it revealed that the positive organism was Pseudomonas, and appropriate antimicrobial therapy was initiated. The gangrene went from wet to dry, and the fever subsided, showing an indication that the infection had been controlled. So peripheral arterial disease, it usually progresses slowly, but eventually There is a severe reduction in the arterial perfusion, and this is often precipitated by minor trauma or injuries, which can lead to a cold blue toe, which usually becomes necrotic unless the foot is revascularized. Many diabetic feet with a very low pressure index do well until the skin is breached by an injury. Inflammation and successful healing make increased vascular demands, which the ischemic foot is unable to fulfill. And that is why when we see diabetic patients with diabetic feet, the three main features that worsen the condition are that the patient has already has neuropathy, so he has lost the sense, uh, the healing ability has slowed down, and then the possibility of opportunistic infections has increased. So all of the three characteristics combine to increase the potential of developing a diabetic foot. This is another case study. It's about a trash foot after angioplasty. So acute ischemia, as you can see in these diagrams, there is acute ischemia in the foot, and the foot is gray and cold, and it needs a distal bypass to save the limb. 2 days after the distal bypass, the foot has developed small blisters on the dorsum, and the tips of the toes are discolored. 2 weeks later, the discolored areas were necrotic. 1 month after the discoloration was first noted, the necrosis demarcated and stopped extending. So, as you can see, that uh, the earlier we conduct an intervention, the better the results are. If we let it linger on, there are chances of further complications. The vascular control is very important. All neuroischemic feet that present with necrosis must have Doppler studies to confirm the ischemia. This has uh, been followed by a non-invasive, this is a non-invasive investigation, and the patient should initially have duplex angiography, which is optimal in showing stenosis or occlusion in the iliac and femoral or popliteal arteries. Tibial arteries are sometimes difficult to visualize. Uh, with, with this technique, because of excessive arterial circulation, however, if the Doppler sonograms show monophasic damped, and as we move forward in this section, we will be showing you the wave trends in an ideal Doppler scan. So, magnetic resonance imaging can also be used. In the case of wet necrosis, revascularization is necessary to heal the tissue deficit after operative debridement. In dry necrosis, which occurs in the background of severe arterial disease, revascularization is necessary to maintain the viability of the limb, and it can be achieved through angioplasty. Now, angioplasty, in some patients, it increase the perfusion following angioplasty, but it may be useful and will result in improved ischemic wounds. As an alternate procedure to angioplasty, arterial stenting now is also being carried out. This has been fully established as a useful treatment in the iliac artery and good long-term patency of the stent. Another technique that can be used is an arterial bypass. Angioplasty rarely restores pulsatile blood flow unless a very significant localized stenosis in the iliac or femoral artery has been successfully dilated. When the limb is severely ischemic, there is considerable tissue deficit. It is necessary to restore pulsatile blood flow. This is best achieved by arterial bypass. Uh, Major amputation in the neuroischemic foot is necessary in the following circumstances. There is overwhelming infection which has destroyed most of the structures of the foot, and it is essential to save the life of the patient. There is severe ischemia with rest pain and cannot be controlled. Extensive necrosis secondary to a major arterial occlusion has destroyed the structures of the foot. Infection has irreversibly destroyed the structures of the foot. Charcot's osteoarthropathy has destroyed the ankle joint. Attempts at external stabilization have been have failed multiple times, and increased fixation is not possible. Post-operative mortality is higher in above-knee amputations, 10 to 40%, than in below-knee amputations, which is 5. Now, we're moving on to the classification of the Doppler waveform. If you're a final year medical student, this might go beyond the scope of this discussion, but it's always nice to gather a few points that might be beyond your comprehension at this point. Hopefully, they will uh, fix in the schemas that you are developing in your cognition and help you later on in your life. So, we're looking for triphasic, biphasic, sharp monophasic, and monophasic waveforms when you're conducting a Doppler. Now, a radiologist would be conducting these investigations, but as physicians and as surgeons, it is important for us to interpret the results as well, so we make the right decisions at the right time for our patients. This is a usual image from the Doppler scan, and this is a color Doppler scan. As you can see, the image is self-explanatory. So, alternative tests used to unmask peripheral arterial disease to show disease. Now, this is the first figure is a norm triphasic scan, and it consists of forward flow in systolic peaks. You can see that there are three peaks in the first diagram. In the second diagram, you can see that this is a biphasic, often mild to moderate stenosis, and you can see two peaks. The monophasic waveform is like a straight line, few phases here and there. So, and then there is absence of any waveform in the case of a complete thrombosis.
You'll hear a triple beat per pulse. This may indicate pulses are bounding and elastic. This can be normal or indicate high blood pressure.
These are the sounds that you would expect to hear, and these are the images when you are expecting to hear a triphasic CT from a doctor. This is an explanation of a biphasic.
Biphasic pulse. You will hear 2 beats per pulse. This is considered normal.
Right.
Flow reaching the foot. This sound is a monophasic pulse. This is 1 beat per pulse and is abnormal. This may suggest reduced blood flow with signs of peripheral arterial disease.
So you heard all of the three, triphasic, biphasic, and monophasic. So you can now better understand the difference in sound and also the difference in waveform from the previous three slides. This is a short video
A Doppler
that has been
ultrasound is a device which uses sound waves amplified through a microphone to bounce off blood cells. This allows you to listen to the quality of blood flow of the artery. These are the parts of a Doppler that you will need to know. Start the process by ensuring correct hand hygiene practices have been followed before seeing a new client.
So X-ray only will show altered bone findings when 40 to 70% bone resorption has occurred. When osteomyelitis is highly suspected clinically, negative X-ray cannot exclude osteomyelitis. X-rays of the diabetic foot can be helpful in detecting foreign body, gas, joint effusion, and osteolysis, uh, but they're not the the gold standard for diagnosis. So you don't completely depend on the X-ray. So this, as an example, is an X-ray. Uh, there is periarticular osteopenia involving the second to fifth metatarsal joints, lytic area in the fifth metatarsal head, neck, and cortical breach, soft tissue swelling with air foci in the mid foot laterally. No arterial calcification is seen. This is another example from an X-ray finding. As you can see, there is presence of ulcers on the head of the first, second, and third metatarsal with associated osteomyelitis and significant bone resorption. This is a very clear X-ray and shows there is a lot of disconnect between the bones and all of the structures. Any layperson can look at this X-ray and see what's happening around here. Imaging in the diabetic foot. Foot complications in diabetes need early diagnosis to start timely therapy and prevent amputation. Diabetic foot remains a challenge for the clinicians due to confusing clinical picture and associated complication. It may present as neuroarthropathy, septic arthritis, osteomyelitis, ischemic devitalized bone, or as so tissue complications such as cellulitis, myositis, ulceration, callus formation, sinus tracts, abscess, muscle degeneration, tenosynovitis. Awareness of various imaging findings of a diabetic foot, their relevance to the therapeutic decision, and correct usage of various imaging modalities to answer the pertinent clinical questions are very important to improve the patient's management and to reduce complications and morbidity and eventually mortality as well. So these are some radiographs uh, which show changes in the bony structure and also in the soft tissue of the foot. The details are given below. You can read through these, and these are pretty straightforward. The diagrams have been clearly labeled. So these are some of the definitions of foot ulcer. Uh, there is first ever foot ulcer that is occurring in a person who has never had a foot ulcer before. Then there are recurrent foot ulcers, people having foot ulcers repeatedly. There are superficial foot ulcers, as the name indicates, that the ulcer does not penetrate deeper structures and is superficial on the skin and soft tissue. And then there is ulcer-free survival days. So all of these definitions are operational definitions that you must read. You can go through these definitions as you further proceed in this course. Now, all we have three questions for you with the answers as well. All neuroischemic feet that present with necrosis must have Doppler studies to confirm ischemia. Post-operative mortality is higher in above knee amputations, and periarticular osteopenia involves second to fifth uh, MTPs. I thank you for staying with me, and I hope that you have learned a lot from this session, and I wish that you would remain with us throughout this course. Thank you.